Cancer and what to expect from my treatment. What is cancer? Cancer is the uncontrolled growth of abnormal cells in the body. Cancer develops when the body's normal control mechanism stops working, causing abnormal cells to multiply and grow more rapidly than normal cells. These extra abnormal cells may form a mass of tissue called a tumor. Cancer is usually named after the body part it originated in. Some exceptions are cancers that start in the blood or lymph and are called leukemia or lymphoma. When cancer starts in one area of the body and moves to another, it is referred to as metastasis. Possible treatments available: surgery, radiation therapy, drug therapy, oral or IV, or you may receive one or a combination of these therapies. Your care team will go over all of your options with you. How does chemotherapy work? Chemotherapy can be given through a vein, intravenously, or IV. Some chemotherapies may require a port or PICC line for administration. Some chemotherapy is available in a pill form. Chemotherapy disrupts the rapidly growing and dividing cells as well as the healthy cells, which can lead to side effects. Chemotherapy travels through your bloodstream to all parts of your body. The length of your treatment will depend on what is prescribed. Please ask your care team for more information. Potential chemotherapy side effects. At every appointment, you will be asked about side effects. It is important to report this to your care team so that we can help you manage these. Remember, we are a team and we're to help you in this journey. Bone marrow suppression. Bone marrow is the spongy material in your bones that produces white blood cells, red blood cells, and platelets. Chemotherapy can suppress the bone marrow, making it difficult to produce these. White blood cells, or WBC, help protect your body from infection. Neutrophils are the most common type of WBC that fight infection. Chemotherapy can cause a drop in the normal number of white blood cells within 7 to 10 days after treatment and will begin to recover within a week depending on your treatment. A drop in WBC puts you at higher risk to develop infections. Reduce your risk of infection. When your WBC count is low, it is possible to get an infection from the normal bacteria that lives in your body due to the weakened cells. Wash your hands thoroughly and frequently, especially when preparing food and using the bathroom. An alcohol-based hand gel can be used when soap and water are not available. Keep your mouth clean. Avoid people that are sick with flu or cold. If you have any pets, ask a friend or family member to clean your litter boxes or bird cages. If you develop a fever. If your temperature is higher than 38 degrees Celsius or 100.5 degrees Fahrenheit, call the clinic right away at 253-428-8700. If you begin having shaking chills, go straight to the emergency room or call 911. Inform staff that you are on chemotherapy. If possible, inform them of the last date of your treatment and the name of your oncologist. Do not take Tylenol, Advil, or aspirin or any other fever-reducing medications until directed by a provider. Other signs of infection: frequent urination, rash, sore throat or mouth, cough, pain, tenderness, or redness, or difficulty swallowing. Please call our triage department at 253-428-8700 if you are experiencing any of these. Low red blood cell count, or RBC. Red blood cells carry oxygen through your body. Chemotherapy may lower your red blood cell count. Some side effects are weakness, fatigue or feeling tired, dizziness, lightheadedness, shortness of breath, or headaches. It is important to notify your healthcare team of these side effects. Low platelet count. Platelets help the body to stop bleeding by forming clots. Chemotherapy can affect your platelet count. When platelets are low, it may cause bleeding from your nose or gums. You may notice blood in your urine or stool or red spots on your skin. Avoid taking medications containing aspirin if advised by your care team. Use caution when handling sharp objects. Use an electric razor when needed and a soft bristle toothbrush and floss gently. If you experience any of these, please contact our triage line and alert your care team. Hair loss. Not all chemotherapy drugs cause hair loss. Hair loss will typically occur 2 to 3 weeks after your first treatment. It is usually a temporary side effect. Please speak with your care team. We can help with resources. Mouth sores. The lining of your mouth is made of tiny, rapidly dividing cells that are sensitive to chemotherapy. If major dental work is planned, speak with your care team first. Care for your mouth. Use a soft bristle toothbrush. Avoid commercial mouthwash that contains alcohol. Biotin is a good option. Rinse your mouth frequently. Combine 1 teaspoon of salt, 1 teaspoon of baking soda, and 4 cups of water. Do not refrigerate. If you have any questions or concerns, please give our Triage nurse line a call at 253-428-8700. Food and beverages to avoid if you have mouth sores. Salty, acidic, spicy, or abrasive foods or beverages. Rough, hard, or crunchy. Very hot or cold in temperature. If you see white spots on the inside of your cheeks and or have a coating on your tongue, please call the office right away. Nausea and vomiting. If nausea medication was prescribed by your care team, take as prescribed. Eating small, frequent, bland meals may help. Stay hydrated. Drink 6 to 8 glasses of fluids a day, water preferred. Limit coffee and alcohol. Do not wait to see if the nausea gets worse. Please call us at 253-428-8700. Constipation. Some chemotherapy, pain medication, and nausea medication can cause constipation. Do not increase fiber intake without discussing this with your care team. Remain as active as possible when possible. Drink plenty of water, 6 to 8 glasses daily. Do not use suppositories or enemas unless advised by your oncologist. Laxatives or stool softeners may be needed. If you have not had a bowel movement in 3 days or are severely bloated stomach, please call the Triage nurse line at 253-428-8700. Diarrhea. Some treatments, bowel surgery, radiation, or antibiotics may cause diarrhea. Try to eat foods low in fiber. Avoid fried, greasy foods that cause gas. Laxatives should not be taken. If you've had 3 or more episodes of diarrhea, please call our nurse triage line. Diarrhea can cause you to become dehydrated. Call us first. Fatigue. This is the most common side effect of chemotherapy. Take frequent rest breaks. Balance rest with physical activity. Set daily priorities and complete during the time you have the most energy. Listen to your body and rest as needed. Ask for help. Damage to the nerves. Some chemotherapy drugs can damage nerves throughout your body. Symptoms are hearing loss, numbness, burning, tingling pins and needles in your hands or feet. Muscle weakness can make everyday activities difficult. Constipation, difficulty with urination. Typically, these symptoms are temporary. Inform your care team with any new onset of symptoms. Blood clots. Blood clotting is essential to your body to help stop bleeding after an injury. Chemotherapy makes you a higher risk for developing blood clots. There are 2 types. The first one is deep vein thrombosis, or DVT. It forms in the deep veins of the pelvis, arms, and legs. You may be at higher risk if you have a centralized catheter. The second one is pulmonary embolism, or PE, and that's a blood clot that travels through the bloodstream from a deep vein to the lungs. Symptoms of blood clots. Symptoms of a possible DVT are sudden recent swelling of one arm or leg, or unexplained redness, tenderness, or pain of one arm or leg. Symptoms of a possible PE, or pulmonary embolism, are sudden recent shortness of breath or feeling like you can't catch your breath, sharp chest pain or upper back pain, especially when breathing in, lightheadedness, or coughing up blood. These are medical emergencies. Sun exposure. Some chemotherapies can make you more sensitive to the sun. Wear sunscreen with a minimum 30 SPF. Cover up when outdoors. Wear a hat or stay in shaded areas when available. Intimacy and sex. It is important to maintain intimacy. Chemotherapy can be present in semen or vaginal secretions for up to 48 hours, up to a week. If you engage in sexual activity, it is important to wear a condom, regardless of which partner is receiving the chemotherapy. Prevent pregnancy during your cancer treatment. Chemotherapy can have a negative effect on the sperm and eggs. If you have questions or concerns about sex or intimacy, please speak with your healthcare team. Anxiety or depression. Feeling anxious or depressed are a normal part of this journey. We have licensed social workers that can provide support services as well as counseling. You are not alone. Body fluids and waste after chemotherapy. Chemotherapy can remain in your system for 48 hours up to 7 days after your last treatment. Body fluids such as urine, blood, stool, vomit, semen, and vaginal secretions must be handled with care. Flush toilet twice with the lid down. Soiled linens or clothing should be washed separately. No special considerations for dishes or cutlery. Questions specifically about your treatment? You will receive one-on-one drug-specific teaching prior to your first treatment. You are encouraged to write down any questions you might have about your treatment or possible side effects so that they can be addressed. How to be more comfortable during your infusion. Bring a blanket. Bring a comfort item. Bring a book, tablet, or small snack. Beverages should have lids. Please avoid bringing strong-smelling foods. Please bring only one family member or friend. No one under the age of 18 is allowed in the infusion suite. Enjoy our free Wi-Fi. Please bring headphones for all electronic devices. We are here to help. Call our nurse triage line at 253-428-8700 if you are experiencing a fever, vomiting, uncontrolled nausea, inability to drink or hold down fluids, diarrhea, constipation, blood in urine or stool, new swelling, mouth sores, new or worsening pain, discoloration, pain or changes of temperature in legs, arms, and neck, redness or swelling or pain at the injection site of your chemotherapy, or any other concerns. Please call 911 if you experience any new or worsening shortness of breath, sudden or new chest pain, any decreased level of consciousness, or sudden or new bleeding.